Hello friends, I am Dr. Shubhash Saini, Senior Consultant Cardiologist practicing in West Delhi and Director of Spandan Heart Clinic, Janakpuri. Today I am going to discuss about edema. As we know that edema literally means swelling, and we know that in medical term the edema can be peripheral edema, it can be edema like cerebral edema, but today we are going to discuss about the peripheral edema. And peripheral edema, if we can see, it can be a symptoms like patient can complain of the swelling of limb, and it is simultaneously as a sign of some maybe a very simple thing like a physiological edema, or sometimes it can be associated with serious conditions like heart failure. So if we see that physiological edema can happen in patients, uh, especially in old age people, patient is having less hemoglobin, or patient is having hypoproteinemia, you can see the mild edema of the feet we can see in those patients. But some serious conditions like heart failure, chronic kidney disease, and liver disease like cirrhosis of liver is associated with edema. Some localized edema or inflammatory edema is also there, maybe because of the insect bite, or sometime maybe unilateral or bilateral deep vein thrombosis. Deep vein thrombosis, it can happen in lower limb, it can happen in upper limb also, especially patients who are on chemotherapy and patient having some different say port in the upper limb. So sometime we may get deep vein thrombosis in upper limb also. Coming to the lower limb edema, which we are seeing commonly, it is associated with heart disease like chronic heart failure, then CKD, because of the maybe because of nephritis or sometime nephrotic syndrome. In nephrotic syndrome, we see the huge edema of the whole of the body. Then liver diseases like cirrhosis of liver is associated with, of lower limb edema, but more it is associated with the ascites or of the abdomen, or what can say the we can say is the fluid accumulation in the abdomen. So when the patient is coming to us with the swelling of limb, so we have to take the detailed history of the patient, that what is the precipitating factor, what are the associated symptoms like shortness of breath is there, whether there is a fatigue, some side associated with the anemia and the hypoproteinemia. Then of course the sex is also important, because in female we may get some physiological type of edema during pre-menstruation period or during perimenopausal period. So when we are sure that patient is having lower limb edema, then we have to examine the carefully to rule out the underlying cause of the edema. So we have to take the heart rate, blood pressure, we have to examine the JVP, and edema is usually examined in the lower limb. We have to give pressure to the shin of the TB about 30 seconds and see whether it is pitting or non-pitting. After the diagnosis of the edema, it is utmost important that we have to investigate the patient to find out the cause. So we have to investigate like laboratory investigation like hemogram, kidney function disease, KFT, LFT, then serum iron studies, and of course not to mention about the thyroid. Thyroid is also associated with the generalized lower limb edema. So once the diagnosis is asserted or diagnosis is done, then we have to think about the treatment of the edema. So first, when we are sure about the diagnosis of, then first correct the underlying cause. If the patient is having anemia and hypoproteinemia, we have to give supplement the iron, we have to give the protein. Then if the patient is having hypothyroidism, then we have to give thyroxine. Then similarly, the patient is having heart failure, then we have to treat the heart failure, CKD, and liver disease accordingly. For the symptomatic relief of the edema is very important, and to relieve this edema, The drugs which we are having are the diuretics. Diuretics, which we know that it what we are using is loop diuretics like torsemide, then furosemide, which we are using, then thiazide like diuretic like chlorthalidone or hydrochlorothiazides, then the potassium sparing diuretics like aldactone and eplerenone, which we are using. Then we have to see whether patient is having a DVT. We have to do the investigation, like we have to do the Doppler of lower limb sometime to rule out the venous thrombosis, then D dimer, and we have to treat accordingly and relieve the patient. Thank you.